Hi guys, today we will be discussing about the initial triage and tagging. We do triage and tagging in cases of mass casualty, meaning there are multiple number of victims. So, what are the scenarios for this? It can be a bombing situation, it can be a fire, it can be an earthquake, meaning as a rescuer, you are to handle mass casualty, meaning there are more than one victim, more 20, 10 or more casualties on the side of the emergency. So, what is triage? So, let's try to define what is triage. So, a triage is a process used in sorting patients into categories of priority for care and transport based on the severity of injuries and medical emergencies, meaning a process of sorting patients into categories of priority of care. We need to sort out the victims. Does this victim needs immediate care, or is this just a minor victim who those victims who just have minor injuries, or is this victim dead? Okay, no pulse, no breathing. So, depending on the priority of care, we do tagging. Okay, so we do sorting to make sure that we are still able to save those patients who needs immediate care. Okay, so when it comes to the priority of care and the transport based on the severity of injuries and medical emergencies. So we categorize, no, depending on the priority of care and transport. So, basing on what? The severity of the injury and medical emergencies. Unsa may mga medical emergencies? Heart attack ba ni siya? Severe bleeding na ba ni siya? Severe ang internal bleeding ba ani niya? Possible. Is the victim in shock? So, these are just some of those medical emergencies. Now, start. What is start? How is it related to triage? Start kono, START. It's a method of triage that has been proven to be very effective, and patient's evaluation is based on the three primary observation. So start, no, start method of is a method of triage. So we use start, no, we applied the start procedure when we do triage, no, when we do triage, or when we do sorting of the victims. So the patient's evaluation kono is based on this three primary observation, and the mnemonic for this is RPM. What does RPM stands for? R for respiration, P for perfusion or circulation, and M for mental status. So we need to check these three: respiration, perfusion or circulation. And the third one is the mental status of the victim. Okay, so that's RPM. So as we use the start method of triage, no? So we do patient evaluation using these three evaluation. R for respiration, P for perfusion or circulation, and M for mental status. Next, how do we tag the patients? So we do color tagging. Okay, so depending on the priority. So first is the red tag. So the red tag is considered as the first priority. That's priority one, red tag. So meaning if you tag, or if the patient is already tagged as red, no, meaning it's priority one, the patient needs immediate care, and meaning the situation of the victim is already life threatening. So that's red tag, meaning the patient needs immediate care. Next is the yellow tag, second priority or priority two, meaning the patient or the victim needs urgent care. Okay, see, red is immediate care, see, yellow needs urgent care, meaning the patient needs to be transported and treated, but can be delayed up to 1 hour. So up to 1 hour. So that's yellow tag. The victims or priority two, the victim needs urgent care, okay, needs to be transported and treated, but this treatment can be delayed up to 1 hour. That's yellow tag. Next is the green tag or priority three. So delayed care. So the victims no needs treatment, but delayed care is fine. Now transport and treatment can be delayed up to 3 hours. Kung si yellow, if transport and treatment can be delayed up to 1 hour only, that's yellow tag. So victims who needs urgent care. Si green tag, okay, needs to be transported and treated, but can be delayed up to 3 hours. That's green tag. Next is the black tag or priority 4. The last ng tag na to. No care is required because the patient is already tagged as dead or deceased. So those are the four no, color tagging of a victim or a patient. You have the red, immediate care, priority 1. Yellow, urgent care, priority 2. Treatment can be delayed up to 1 hour. Green tag, priority 3. Treatment, transport and treatment may be delayed up to 3 hours. No, so it needs delayed care. And the last one, that's black tag. Um, no need. So priority 4, no need, no care is needed because the victim is now tagged as dead. Okay, so that is now for the tagging of patients or victim. Now, start. What the start stands for? Okay, so this method no, that we use when we do the sorting of victim, we use the start method. What the start means or stands for? Start stands for simple triage and rapid treatment. Simple triage and rapid treatment. So that is what START means. So by using a casualty sorting system, you are focusing your activities in the middle of a chaotic and confusing environment. And you must identify and separate patients rapidly according to the severity of their injuries and their need for treatment. So you need to sort the victims fast. You need to be able to identify the type of injury and the type of treatment needed, and you need to do it fast. So in this type of situation, the scenario may be that help yes is coming but madugay pa siya, or there's not much rescuers or there's not much medical team who could assist. Possible that it happened in an isolated area na maghulat pa ta kung ano sa when is help coming, but rescuers are there, and these rescuers, actually not all these rescuers are trained. So you will just have, so when you volunteer as a rescuer as much as possible, you have that idea no so it's already instinct no may balaan na nato if the victim needs immediate care. So for those victims nga naglisod na gani ginawa, when it comes to respiration, iba katuwa sa RPM, when it comes to respiration and breathing, if the victim is not breathing properly or is not breathing but the pulse is there, no, so meaning that you consider that victim as immediate. Kinahanglan na siya i-treat dayon. Kay ug dili na nato i-treat dayon, possible that the victim will die. Okay? So we should know what are these life-threatening situation no nga condition sa victim. So if minor injuries lang, wounds, no, gagmay nga wound, there's a sprain, there's a dislocation, so that you can consider, you can delay the treatment for that as long as you can give first aid no and help relieve the pain that they are feeling. Okay, so okay ra na siya, treatment can be delayed, but for those no nga wala nagaginhawa or kalisod og ginhawa or ang pulse or the vital signs are not stable, then they need immediate care. So they need to be tagged as red immediately para mabalaan sa uban rescuers who to transport first, who among those victims needs treatment first. Okay? So when it comes to en route, what does en route means when it comes to the start method? So en route, even while you are responding to the scene of an incident, you should be preparing yourself mentally for what you may find. So perhaps you've been to the same location. Where will help come from? Itan-aw nimo dito, kanira bang lugar diri murag lisod ta makapangayo og tabang dinhi. Or kaning lugar diri is hinay ang signal. So magdakop-dakop ta signal para lang makakuan og help. Or well, what is the nearest hospital? What is the nearest nga barangay nga kuan siguro? Ingon ana, what is the nearest health center who will be able to send help for us or call for help? Now, how long no ang travel time sa emergency team to arrive on that specific area? So, dapat kabalo ka ana. At least you will have an idea. So, when you call for help, no, mahatagan nimo sila idea. Kanira ba din there might be a possibility that if ever you'll be calling me back, no, you might have a problem um, contacting me because our signal here is unstable. So at least you have that idea. So when it comes to the location, asa man ni siya, what is the nearest route nga pwede maagian sa atong medical team to arrive there immediately, no, sa shortest possible nga span of time nga maabot dito. So that is dapat when you do this, when you use the start method, no, en route is very important. Okay, so you should be prepared. You should have the idea, no, that way you'll be able to help. Makatabang ta. Next is initial assessment. When you do initial assessment, of course it's very important, please stay calm. Stay calm, stay focused. Why? Because if you're not calm, definitely you will not be able to think properly. You will not be able to focus on what treatment you can give. You will not be able to sort the victims properly. No? Basin marong-rong, masayop na hinuon nimo og sorting, kuan na. Pagtanaw nimo dito sa victim, patay na. Imbis gani nagaginhawa pa to. Kay wa nimo siya nauna og transport. Okay? So, the first thing you should do upon arriving at the scene of an incident is to try to stay calm, look around, and get an overview of the scene. Unsa kay possible nga nahitabuan ni nila, no? And then these visual surveys give you an initial impression of the overall situation, including the potential number of patients involved and possibly even the severity of their injuries. So the visual survey should enable you to estimate initially the amount and type of help needed to handle the situation. So, what to do? So, stay calm, nakadungog kag buto, no? Somewhere, then pag adto nimo, ayaw karatol. Stay calm. Why? For you to be able to look around, no? For you to be able to get an overview of the scene. Unsa kay posible nga nahitabo, no? For you to be able to get that visual survey, no? And give you the initial impression of the overall situation. Makakuan ka, though it's not the complete yun nga kuan, no, nga overview. Well, you're not sure, you were not there, no, you just witnessed that. You're not there, you just heard something, some people were shouting, so you went to the area. So you need to make sure, you need to be able to survey the whole area. Do not just focus on one victim because there's a possibility nga nung isa raman niya ka-victim akong nakita nga daghan man tong tingog akong nadunggan ganiha nga nagsyagit. There are a lot of people shouting. How come I'm only seeing this one victim? So you need to survey the whole area to know how many victims are there, how many casualties are there. So visual survey is very important. And um be calm, stay focused for you to be able to identify the injury, for you to be able to categorize, know which has the most injury, which has the most severe, which is the severe, which among the victims has the most severe injury, no, which one has severe bleeding, which one is dead. Okay, and these visual surveys should enable you to estimate initially